DeBar, Billingame, Frazier, Harkins, Hickman, Hill, Hobson, Johnson, McMahon, Parks, Polk, Tate here, Turner Ford, Wiggins. Mr. Chairman, a quorum's present.
I think he did that just as good as the secretary does, doesn't he?
Better.
Yeah, well, we've got something to look forward to. A new talent. The first item on the agenda is the House version of a bill we considered earlier to conform one code section of the code to a 21-year-old age for buying tobacco products. The language is everywhere in the code except this one code section. So I'll call up House Bill 668 and entertain a motion out of sufficient to pass. Having heard such a motion, is there debate or discussion? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 674 is the Interstate Dental Hygiene Compact with other states. I'll entertain a motion to rise and report. Excuse me. Don't get your hopes up. I'm so tired. I'll entertain a motion title sufficient to pass. Although I sort of wish that motion would get, more popular.
Go back.
Motion title sufficient to pass, and I recognize Senator Barnett.
Thank you, Mr. Chairman. Mr. Chairman, would you be open to an amendment now, or could we work on something before it's brought up on the floor in regards to the dental hygienist?
We can, but this is an interstate compact, and I think that an amendment to this bill would not be germane because it's a compact and we can't change the way the compact reads.
Okay. Thank you, Mr. Chairman.
In other words, my understanding is this is sort of, it's a compact. We have to pass the same compact exactly like the other states did, and it's sort of a world of its own, I think.
Thank you, Mr. Chairman.
Further questions, discussion? Senator Turner Ford.
Thank you, Mr. Chairman. My question is, and I understand it's a compact and it's the same legislation for those states that have adopted it. Are there any alternatives to this particular compact?
I'm not sure that there are. I think in the back of my mind, I'm told there are another compact, but other states with other compacts, but they're not supported by the State Dental Association and not supported by the State Board of Dentistry, because the competing compacts cede what should be governmental authority, at least in my view, to private organizations.
Thank you, Mr. Chairman.
That's my understanding. Senator Parker.
And I do think you alluded to this in the response to Senator Turner Ford, but this compact is the one that has been recommended and kind of checked off by the dental board and the dental association. Is that correct?
Yes.
Thank you.
Further discussion? Ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 807 is a bill which is doubly referred to appropriations. This would establish within the Department of Mental Health a division of autism services. Is there debate or discussion? Ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1083 is the Healthcare Expendable Fund. This is the fund into which the tobacco tax settlement money or the tobacco settlement money is paid, money's appropriated out of it, the fund itself repeals, and this would just extend the repealer on the existing fund, which is necessary to appropriate out of it. I'll entertain a motion, title sufficient to pass. And are there questions or debate? If not, are you ready to vote? Yes,
So does it extend the repealer or does it delete the repealer?
I believe it extends the repealer until it either extends or they just remove the repealer. The short title is inaccurate. It removes the repealer. I don't know why we would have a repealer on this fund itself, which we've got to have in order to appropriate out of it.
Okay, Mr. Chairman, between now and the floor, could council maybe get us some information on the history of this and how the repealers have been extended over the years?
Well, okay, I don't know about the history of repealers, but the fund itself came about because of the tobacco settlement. And there's the money is paid into this fund and appropriated out of it. Anyway, but yes, we'll certainly get that information. The motion is title sufficient to pass. Further debate? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1402 is the House version of a bill we passed earlier. What this does is there's a fund in the Department of Health, which allows money to be appropriated out of, and this would just allow the appropriations people, if they want to use it for broader purposes. Senator Wiggins.
Question of the chair.
Yes.
This bill's brought up, I think, a peripheral issue that maybe the chair has information on. But if I'm not mistaken, death records are under the Department of Health Bureau of Vital Statistics. Am I right about that?
I think that's correct.
I've received, again, calls from constituents about the unbelievable amount of time it takes to get death records. And I just received a call about a week ago. And I'm wondering if the chair has any information. I see the vice chair over there nodding his head. Maybe he has some information. And this is not the first time this has come up. And if we are considering such legislation, I think this is a topic that needs to be explored.
Well, my thought in putting the bill on the agenda is this is an appropriations decision, and it was an attempt to get the bill to the Appropriations Committee and so that they could decide what they thought of the wisdom of doing this. I just try to give appropriations flexibility. But having said that, I'll bet you that before this session's over, we can get a mighty good report about what the problem is with the death certificates. At times in the past, when we've looked into this, we found that the paperwork is not made it to the Department of Health, and people at home or trying to blame the Department of Health. Also have been told that there are issues getting death certificates from places when someone passes away. My surmise is it's a combination of a number of things. But since you raised this issue, we'll get an update on that before we go home.
See, I knew the chairman would have all the answers to my questions, for which I appreciate that. So
Senator
I'd be
Wiggins,
anxious to hear the
I
report.
I have all manner of answers to all manner of questions. Whether they are accurate or not is another matter, but I've got lots of answers.
Well, if we could, and I do thank
No,
the
it is,
chair for that.
it is a chronic problem, and now that you've reminded me of it, we'll find out what's going on.
And just to be the constituent is neither a government agency, they are, and I think the chair would understand this completely, are just a person who was handling a death estate or whatever, and it was absolutely frustrated by
I've had the exact same thing happen with my constituents. I know exactly what you're
Okay, thank you, Mr. Chairman.
doing. The motion recurs on title sufficient to pass. Further debate? All in favor say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1404 is before us, and I believe there's a proposed strike-all amendment in your packet. So I suppose to get us in the right procedural process, we need a motion title sufficient to pass and a motion to adopt the amendment. Okay, having a motion title sufficient to pass and a motion to adopt the amendment is now before us. It's my understanding that there is a recurring issue when people are trying to be committed, or there's a procedure involving those who are in institutions and getting an examination from someone who's essentially already been examined. And so this provides the underlying language beginning on line 33. And then the substantive change is also section 6. The difference in the strike-all amendment is that after the bill passed the House, there were some technical changes that were suggested, and they were rather numerous, so they're just all put into this one strike-all, but I think it's essentially the bill that passed the House. A bit tighter language. So are there further debate or questions? Senator Parker.
So because this is new language here that I haven't seen, has there been any conversation with the Department of Mental Health over the language in section 6?
I've been informed by the chairman of the House committee that it's been reviewed by them and others, and that they are happy with the language in the strike-all.
Okay, thank you, Mr. Chairman.
Senator Hickman.
This is just for understanding, this is in the committal process, and this makes it, I'm guessing if someone is already in care, this makes it slightly less strenuous for coordinating all of these things at different points. Is that the purpose of this?
I'm sorry, I got lost. Can you say that again?
Like, well, of course, when you want to go through the committal process, you have to coordinate and line all of, you have the pre-screen, all of that. That makes this less strenuous if this person is already in acute care with someone.
My understanding is the practical effect is that if you're actually in a facility, that it makes it easier to get the required affidavits.
Thank you.
If there's no further debate, Senator Hill.
The only question I have is down here on lines 845 to 849, where it says an interview with a proposed patient and other individuals who appear to have knowledge of the condition of the proposed patient if practicable. In-person interviews with the proposed patient are preferred if the proposed patient is not interviewed. Specific reasons must be documented. So that's the only concern that I have is why wouldn't they be able to, I guess, interview a proposed patient
Either,
themselves?
either A, it's not possible to interview the patient, or B, it's not safe to interview the patient. We're dealing with a category of people who are in distress.
Yeah, but we got telemedicine now. So, yeah, I guess if they're so out of control that the parents can't, or the family can't control them, I guess that would be your answer.
I'm sorry, we just have terrible acoustics and I'm having trouble hearing.
I think I understand. I
but
think
I-
I understand what the problem is.
But I think the problem they're trying to address is someone who's in an institution and in such extreme condition that it's hard to conduct an interview with them.
Yeah, I mean, if they're in an institution, there's still, I guess, telemedicine. I mean, you would think that they could still do a telemedicine interview if they were in an institution, even if they were restrained or whatever. But I guess my question would go back to, if they were not in an institution, then that would probably be a harder case if they were not already institutionalized to interview them if they were in such bad shape that nobody could do a whole lot with them. But typically, when that happens, the sheriff's department or somebody's going to be called. I just kind of have a problem with somebody doing a commitment with not actually seeing the person, I guess.
Okay. Further debate? You ready to vote? All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1447 is a bill which would increase the fees for water quality analysts. They have not been changed, I think, in some time. And it's my understanding that the bill that's before us has been seen by the organizations that the Association of Water Systems. I'm sorry. That's the explanation of the bill. Is there debate? Ready to vote? All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1463 involves our attempt to get those who sell pseudoephedrine to pay the fees to the National Association of Drug Diversion investigators that are supposed to be paid. And if the fees are not being paid elsewhere, then the manufacturer is obligated to pay the fees. The underlying language beginning on line 79. There's a motion, title sufficient to pass. Is there debate or discussion? If not, are you ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. We will meet tomorrow at our regular time. Although I just learned today that apparently, I think it was Jean-Paul Sartre who said that 3 p.m. was either too early or too late for any meeting, but nevertheless, we're meeting at 3 p.m. tomorrow. And now it's time for a motion to rise and report. All in favor, aye. Opposed, no. The ayes appear to have it. The ayes have it.